Biological therapies for schizophrenia. Drugs that are effective in treating psychotic illnesses such as schizophrenia and bipolar are called antipsychotics. They reduce dopaminergic transmission, in other words, they reduce the action of the neurotransmitter dopamine in areas of the brain associated with the symptoms of schizophrenia. This reduces mainly the positive symptoms of the disorder. There are two types of antipsychotics you need to know about. First generation antipsychotics are called typical antipsychotics. Examples include chlorpromazine and haloperidol. They target positive symptoms. They are dopamine antagonists. A dopamine antagonist, or antidopaminergic, is a type of drug which blocks dopamine receptors. The drug binds to but doesn't stimulate the dopamine receptors, particularly D2 receptors in the mesolimbic dopamine pathway. It is estimated that between 60% and 75% of D2 receptors in the mesolimbic pathway must be blocked for it to be effective. Side effects. Unfortunately, D2 receptors in other areas of the brain are also blocked, such as those in the extrapyramidal part of the brain that controls motor activity. This can cause extrapyramidal side effects, movement problems, such as Parkinsonian-related symptoms similar to those who have Parkinson's, such as shaking, and also tardive dyskinesia, involuntary movements of the face, tongue and jaw. Newer drugs, called atypical antipsychotics, also attempt to target D2 receptors but avoid the extrapyramidal side effects. Examples of atypical antipsychotics include clozapine, olanzapine and risperidone. They target mainly positive symptoms but can also have a positive impact on the negative and cognitive symptoms of schizophrenia. They temporarily occupy D2 receptors and rapidly dissociate to allow normal dopamine transmission. They also have some effect on other neurotransmitters such as serotonin. Atypical antipsychotics have a stronger affinity for serotonin receptors and a lower affinity for D2 receptors. This is another reason why the side effects aren't as severe as typical, and it is thought that also blocking serotonin receptors may be the reason why negative and cognitive symptoms are also affected.